Welcome back. Hope you had a great weekend and that your Monday is going well. I'm going to ask you a tough question right now, though. How have you been sleeping lately? If you've been feeling overly tired in the middle of the day, you may be one of the millions of Americans who have sleep apnea and don't even know it. Dr. Anna Smith from Dentistry with TLC in Godfrey, Illinois is here to show us how oral appliance therapy can bring you some relief. And she brought one of her patients along, one of her success stories, too. That's David Bryden. David, Anna, welcome back to the show.
Thank you.
All right, Anna, let's start from the foundation here. What is sleep apnea for folks who don't know?
Sure. Sleep apnea is when you stop breathing while you're asleep. And the really dangerous thing about it is that most people don't know that this is happening. And so if you ever hear someone stop breathing while they sleep, that is sleep apnea. I know my husband has sleep apnea, and before he was treating it, what I would hear is just this loud snoring and then suddenly nothing. And I would look over and think, is he breathing? Is he alive?
That's kind of scary, isn't it?
And then suddenly you usually hear a really deep breath. And that is because they stop breathing while they sleep.
Wow. So this is above and beyond snoring. This
Yes.
is really a dangerous medical condition.
Right.
And my jaw hit the floor this morning when I read that 90% of people who have this don't know they have it.
Right.
Enter you, Dave, because
Yeah.
you lived with this for how many, 20-some years before you realized
Probably
what
probably about 25 years. And we thought it was just insomnia because I just plain didn't sleep well. But I had a sleep study done last fall and found out that I have sleep apnea, and there was actually what was happening is I was getting some sleep, and I didn't even realize it. But I was waking up so frequently that I thought that I wasn't sleeping.
So you thought you were literally staying awake all night,
Yes.
insomnia, but really there
Yes.
were little spurts of drifting off to sleep mixed in there.
That's right.
Anna, you've probably heard that story
Sure.
many times. And along comes this bad boy, which is kind of the traditional methodology for treating this. This is the CPAP machine.
It is, and this is one of the main reasons people don't want to find out if they have sleep apnea,
Right.
because they don't want to have to deal with this thing.
Yeah.
And it is the most common way that sleep centers and doctors will have you try to treat your sleep apnea. However, it's not the first treatment option recommended by the American Academy of Sleep Medicine. If you have mild or moderate sleep apnea, they actually recommend this, which is a little appliance. It's like a retainer.
Yeah, no
and it
moving
just-
parts, much
right.
smaller, and it is. It's like a little retainer. So how is this going to help with the sleep apnea overnight?
Well, what happens whenever you sleep with sleep apnea is that your jaw, if this is your bottom jaw, it actually falls back when you sleep, and that closes your airway. What the CPAP will do is it tries to splint your airway open by forcing air down your nose. What this will do is this little appliance just fits over your teeth, and it stops your jaw from falling backwards. And that will also keep your airway open.
So Dave, you've got one of these. How long have you had it? What kind of results have you seen?
I've had it for about 5 months, and the results have been actually tremendous. Only 3 weeks after I had it, I was up at the Mayo Clinic in Rochester, Minnesota, for some other health issues that I'm facing, and I went ahead and had a sleep study done at that time, and like I said, it was only 3 weeks later, and during the sleep study, the oxygen levels were perfect.
Wow. 3 weeks?
Yes.
But I mean, it makes sense that the results would be instantaneous because you're either wearing it or you're not.
Yeah.
And I have to brag on you a little bit, Dr. Smith. You were recently awarded Silver Partner for your dedication to treating sleep apnea patients with this little guy right here.
Yes, very few dentists, especially in our area, have been trained to make these, and so that was an honor. I was glad.
Well, David, glad you've had great success with it. And Dr. Anna, thanks for enlightening us. We appreciate it.
Thank you.
Dr. Smith has been named the top doctor, by the way, of all fast braces dentists worldwide. She's been on the show to talk about fast braces before, so congratulations to you on that.
Thank
You need to visit her, whether you need fast braces or an oral appliance. She does a little of everything. Dentistry with TLC is located just 30 minutes from downtown St. Louis in Godfrey, Illinois. That's the number right there, 618-466-0733. You can call for an appointment or check them out online at dentistrywithtlc.com.